Hi, I'm Molly Sullivan with Golfers MD, your source for all your golf, health, fitness, and injury information. Golfers are prone to shin splints because of the repeated stress to bones, muscles, and joints without proper conditioning or recovery between playing golf or working out. The pain and injury can often cause golfers limited mobility and misplay. Today, we visit with Dr. Rhonda Bosharon, sports medicine orthopedic surgeon and athletic trainer, to tell us even more about shin splint injuries.
Shin splints is a little bit of a generic term. It usually refers to chronic pain in the lower extremity, usually at the tibia or the shin bone. It could be caused from several factors. An overuse injury in this region could be from asymmetry or imbalances in the muscle groups, and then muscle pain at the insertion point of the tibia or the shin bone. Or it could be as extensive as overloading of this shin bone where there's a small crack or a stress fracture in that bone. You usually get shin splints from poor biomechanics causing you to load the shin bone or the muscle groups around the shin bone in an eccentric way, causing it to get overloaded, overused, and then injured. Symptoms usually are on the inside of the shin bone with pain going along the muscle group and even tenderness at the actual bony portion of the shin bone on the mid portion of the leg. An athlete usually can play with shin splints unless there is a stress fracture. A stress fracture will require the athlete to be immobilized as well as non-weight bearing, and of course not allow for them to participate in the sport. The other sources of shin splints may allow the athlete to return to their sport if the symptoms are not significant enough to prohibit their activity level within their sport.
Shin splints is a wastebasket terminology. It's usually referred to as the medial tibial stress syndrome, which is what it says, stress. So increased stress to the front of the lower leg can create an irritation to those soft tissue structures, to the tendons in that compartment, and it actually can also cause some strain to the muscle. One thing in the literature that's fairly common is overpronation of the foot can cause this medial tibial stress syndrome because of the overstretching of those tendons. Another thing could be muscle imbalances. And muscle imbalances when one muscle is too strong and the other muscle is too weak. The calf is generally too strong and generally tighter, so strengthening exercises to the calf could help, and then strengthening of those front muscles that lift the foot up is beneficial. And then of course it is connected to the whole lower limb. We do need to look at the hip in terms of hip weaknesses and strengthening that up. Recovery time on this kind of a problem is again really variable. It depends on the amount of length of time you've had the injury, so that if you're dealing with any injury that you've had for a year, you can't expect to get rid of it in 6 days. But it could be literally that quick to get back on the field. Say if it was a biomechanical problem and you put an orthotic in someone's shoe and the pain just disappears. I mean, it could be as little as 6 days. It could be as long as, again, 8 weeks.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with GolfersMD.com. Remember, at GolfersMD, health equals performance.